The last 5 years have served to highlight the extent to which Vietnam's health sector is in transition. The country is experiencing epidemiological and demographic shifts towards a disease burden characterised by NCDs and an ageing population more prone to chronic conditions. NCDs are now estimated to account for 73% of the total deaths in Vietnam. The proportion of elderly population has increased to 7.1%, and it is expected to take Vietnam about 20 years to move from an ageing to an aged population. Rapid urbanization is also contributing to changes in lifestyles and behaviours, creating new pockets of poverty and new health risks and hazards. These factors are compounding the challenge of NCDs and the provision of services for chronic conditions. Emerging and re-emerging infectious diseases continue to pose a threat to the health security of the country and the region. At the same time as facing these new challenges, the country continues to face old challenges, including malnutrition, stunting, and maternal deaths, all of which disproportionately affect the most vulnerable segments of the population. Yet the past 5 years has seen the Ministry of Health, with support from development partners, make significant progress to implement the 5-year health sector plan for the period 2011 to 2015 and the 7 major tasks of the health sector. These tasks focused on health financing and universal health insurance, the strengthening of the grassroots health network to ensure equity and reduce hospital overcrowding at the higher levels of the system, and the development of human resources for health. During this same period, Vietnam has worked hard to accelerate efforts towards the attainment of all 5 health-related MDGs. It has already made trailblazing achievements and been recognised globally as one of the 10 fast-track countries in the achievement of the MDGs, particularly for its progress in reducing maternal and infant deaths. It has also achieved its malaria, TB and HIV targets, with remarkable reductions in the prevalence of these 3 diseases. The resolution on MDG acceleration requiring that the MDGs be prioritised at the local level, especially hard-to-reach areas, reaffirmed the centrality of the health-related MDGs to the country's socio-economic development agenda and goals beyond the 2015 target date. Over the past few years, Vietnam has also made significant strides in moving towards universal health insurance. One key achievement was the revision of its health insurance law to increase coverage of the poor, ethnic minorities and other vulnerable populations, as well as the informal sector. The revised law has demonstrated Vietnam's commitment to universal health insurance coverage as a means of achieving universal access to healthcare services for every Vietnamese citizen by 2020. Health insurance coverage is now close to 70%. Vietnam is also revising the design of its benefits package to be covered by health insurance for greater cost effectiveness in the use of health insurance funds and to better respond to the needs of the population. The country has made significant progress in reforming its grassroots health system, giving special emphasis to ethnic minority populations and those living in hard-to-reach areas with lower levels of socio-economic development. The grassroots network, meaning the system of primary healthcare facilities and institutions located within a district, now covers the entire country. The physical infrastructure of many facilities has been upgraded, and the grassroots health workforce has continued to grow over the past 5 years. The quality of the health workforce has also improved, including in the most disadvantaged regions of the country. This has helped to address the challenge of hospital overcrowding at the higher levels of the system. efforts have also focused on improving the quality, quantity and distribution of human resources, as well as the attitudes of healthcare staff towards patients. These reforms are also helping to tackle the increasing burden of NCDs by ensuring that services are provided in a way that is convenient for patients and cost-effective for the system. With regards to its obligations under the international health regulations, in June 2014, Vietnam reached a milestone in global health security, fulfilling all IHR core capacities through the implementation of the Asia-Pacific Strategy for Emerging Diseases. The Ministry of Health has consolidated national capacity and international cooperation in order to undertake prevention, surveillance, early warning and rapid response to emerging diseases and other public health events. In February of 2015, the Emergency Operations Centre was established with the support of partners. It serves as the command centre of the MOH for coordinating the emergency response to public health threats, and it reflects Vietnam's commitment to protecting the health of the global community and the implementation of its own commitments under the IHR. Multi-sectoral collaboration and One Health have also been advanced to strengthen coordination between the interconnected sectors of animal and human health. And in August of last year, Vietnam co-hosted a conference on zoonotic disease control in response to WHO's ZDAP, or Zoonotic Disease Action Package. Alongside these achievements, Vietnam has continued to tackle communicable diseases. Its immunisation program covers 12 communicable diseases, and over the past 5 years, full immunisation has remained above 90%. From October 2014 until March 2015, Vietnam organised a campaign to vaccinate against measles and rubella, targeting 20 million children aged between 1 and 14 years of age. The campaign was successful in vaccinating 98.2% of its target population. The government's efforts have also focused on establishing a national regulatory authority for vaccines, and in April 2015, WHO accredited Vietnam's NRA, certifying the safety and efficacy of vaccines produced and used under the country's national program on immunisation. This marked the culmination of over a decade of intensive effort by the NRA office to implement a roadmap developed by national experts with support from WHO to strengthen capacity for the regulation of vaccines. In parallel, Vietnam has continued to prevent and control TB, malaria and HIV/AIDS. The number of new TB cases and deaths has dropped by more than 60% over the past 2 decades. The number of new HIV cases has dropped by more than 3,000 over the past 5 years, and close to 70% of people in need of ARVs have access to these life-saving medicines. In 2014, Vietnam demonstrated its ongoing commitment to reducing HIV/AIDS-related morbidity and mortality by becoming the first country in Asia to adopt the 90-90-90 targets, meaning that by 2020, 90% of people living with HIV will know their HIV status, 90% who know their status will be receiving treatment, and 90% of those on treatment will have achieved viral suppression. The last 5 years have seen important progress in NCD prevention and control. For example, the circular on the implementation of the Tobacco Control Law came into effect in 2013, and higher rates of taxation on beer and alcohol were introduced in July 2015. With the introduction and enforcement of stronger laws mandating the use of quality-controlled motorcycle helmets, the country has also continued to tackle its high burden of road traffic mortality and morbidity. Towards a stronger and more coordinated response to NCD prevention and control, in 2014, the Ministry of Health, with support from WHO, led a broadly inclusive multi-sectoral process to develop the NCD strategy for 2015-2020 with a vision to 2030. The strategy was approved by the Prime Minister in early 2015, and its implementation will help to prevent and control non-communicable conditions that account for the largest burden of NCDs. The country has also made big strides in the areas of pharmaceuticals, food safety, essential health technologies, and medical equipment. Socialisation in the health sector has helped to meet the population's diverse healthcare needs. While those who can afford to pay for additional services are benefiting most from socialisation, other beneficiaries also have greater access to high-tech services, since many are reimbursed by health insurance. At the same time, a stronger regulatory framework for the implementation of the socialisation policy is needed. In the global health diplomacy arena, Vietnam has also strengthened its positions as one of the region's leaders over the past few years. It has been an active member of WHO governing bodies, the Western Pacific's Regional Committee and the World Health Assembly. Vietnam's participation in these forums has been applauded. At the WHO Regional Committee meeting in October of 2015, Vietnam was elected to the Executive Board for the period of 2016 to 2019. In its role as EB member, Vietnam is expected to give a stronger voice to middle-income countries, as well as other ASEAN countries and countries not currently represented in the EB. In September 2014, Vietnam successfully hosted the 12th ASEAN Health Ministers meeting, and in recognition of the role of UHC in the development of the ASEAN community, Vietnam led the organisation of the high-level side event on UHC during the meeting. The session focused on ASEAN countries' efforts to cover their entire population with health insurance, in the context of the challenges of growing economies and the need to address persistent health inequalities among the vulnerable populations and those living in geographically isolated areas. In 2014, the Ministry of Health and its development partners also participated in the IHP Plus monitoring exercise for the first time. And at its retreat in April 2015, the HPG discussed progress and stumbling blocks towards the shared goal of greater development cooperation effectiveness. These laudable achievements, as well as new and persistent challenges, have driven the development of the new 5-year health sector plan for 2016 to 2020. In line with the directions of the Socio-Economic Development Plan, they're also shaping the definition of Vietnam's post-2015 health development agenda. This agenda is underpinned by the principles of health equity and universal health coverage. It aims to build a strong, resilient and transformative health system that takes the community as its client, promotes health and well-being, and ensures that no one is left behind.